therapies. So it's very important to look at, developed by a CDC expert panel on chronic kidney disease, is still relevant today. If you look at the preventive strategies, KD risk factors, impacting on obesity, preventing hypertension by various measures, including dietary measures and diet, a healthy diet. So health promotion is a key, and that's something that our public and primary health care efforts should really be directed at this, so that we don't then need to embark on secondary prevention. But obviously, if we get to these stages, we need to look at how to prevent further. So when we look at stages 1 and 2 of chronic kidney disease, where the eGFR is more than 60 mLs per minute, one needs to pay attention to guidelines for optimal management of diabetes and hypertension. And in more advanced stages, one needs to look at therapy for CKD-related complications, such as anemia, and look at treatment choices, for end-stage kidney disease, and then tertiary prevention is where one already needs kidney replacement therapy, and one needs to really look at how to prevent its impact on cardiovascular health. Screening principles that apply to CKD is well recognized by WHO and the global community. That's a major public health problem with the early and long asymptomatic phase in general, and we can detect this by affordable testing. Treatments are effective, available, and there are cheap options available. So we needn't really deplete all the economies of many countries as the treatment of kidney replacement therapy can do. In fact, emergency visits and urgent care costs and so I'm just going to go through this very quickly. So what does one require to achieve equitable health care, especially as it relates to kidney disease? One needs to really try and quantify the burden. One needs a registry to accurately inform the burden of disease, mental health coverage, and part of the managed care process that could be easily implemented. And then I think critical, together with access to screening, early diagnosis, one should really achieve treatment targets. And then of course we're all challenged by the need for kidney replacement therapy, and we need affordable ways of delivering dialysis and transplantation to our population. The challenges that I've already, and I think greater awareness and education is something that's very important, and it'll help us to. So in concluding, I just want to
then we as human beings start transmitting from one another. So, and then shared with you. The second one is workforce, and then you have information system and surveillance, as we just discussed. You cannot be prepared if you're not collecting this data, and that's all about surveillance. And then the last one is healthcare facilities. So with leadership, and so this is all about policies, guidelines, okay, risk assessment, but also planning, analysis, and also distributing roles and responsibilities. Because at this level, you have so many players. So what does each player do? This is all about leadership and governance. And you will agree with me from my previous slide, when you're talking about zoonotic diseases, if you look at the structure of Tanzania, these are not mainly within the health sector. You know, wild animals belong to a different sector. So how do we come together to make sure that, okay, these diseases that affect animals, but they can also be transmitted to human beings, how do we coordinate ourselves in terms of response? And this is where we have the primary. The other one is healthcare and supporting infrastructures. As I said before, within the country now, we have a very established healthcare systems, starting from the primary healthcare all the way to the tertiary facility. And we've also distributed our public health emergency operating centers strategically. You know, because you cannot have all that you want. So with the limited resources that you have, we were able to map and identify actually which regions are more prone